There has been a misconception between Ozempic and Wegovy. Here I'm going to explain what's the difference exactly. Hello everyone, I'm a pharmacist. I have over 15 years experience working as a pharmacist, pharmacy manager in the retail pharmacies in the United States. Wegovy and Ozempic have the same active ingredient, which is called semaglutide. But Wegovy has more of this ingredient, which is the active ingredient, 2.4 milligram. Ozempic has 0.25 or 0.5 milligram. They are both injectable pens, but what they do is completely different. Wegovy is used for chronic weight management, but Ozempic is used for type 2 diabetes. So these two medications work completely differently. Wegovy is not an insulin, and it is a GLP-1 receptor agonist, which is a glucagon-like peptide. And what it does, it reduces the appetite. That's how it reduces the appetite and also reduces the weight. Ozempic is an insulin. It regulates blood sugar. The injection frequency is different as well. Ozempic is always taken once a week. Wegovy has higher dosage of semaglutide. So how did they come up with the idea of making Wegovy? Because of one of the side effects of Ozempic, which was actually beneficiary, was losing weight. But Ozempic can lose weight up to 5%. However, by Wegovy, patient can lose up to 15% of their weight. So that's how they came up with the idea of making Wegovy specifically for chronic weight management. And when the medication has a higher amount of active ingredient, it also increases the side effects. So as a result, Wegovy could have more side effects or more highlighted side effects compared to Ozempic, because Ozempic is like way less than Wegovy in the semaglutide content. So they use Wegovy for only patients which have BMI with no other conditions, BMI over 30 kilogram per cubic meter. In another post, I'm going to show you how to calculate the BMI. Or BMI over 27, it is also approved for BMI over 27 as long as patient has another condition. For example, obesity, diabetes, heart conditions. They approve Wegovy for that patient as well. So Wegovy usually starts as a once a week injection, and sometimes doctors reduce the frequency to once a month, depending on the improvements, of course. And the other thing that is important here to mention is that the normal BMI range is 18.5 to 24.9, and I'm going to explain how to calculate it in the future post. And just remember that Ozempic is an insulin and is used for type 2 diabetes, and Wegovy is for chronic weight management and is not an insulin. So there was a misconception between the two. I had to clear this up. And also remember, When it comes to insurance coverages, because these two medications are expensive, and I believe Wegovy is even more expensive than Ozempic, of course, because it has more active ingredient in each pen. So it's very important if it's coded properly, so that insurance companies can understand that is for chronic weight management, so you wouldn't have to pay out of pocket. That's very important to know.